Welcome to Benefit Bay Employee Enrollment Training. We are so excited to partner with you in your ICHRA journey. Today, we are going to look at how to complete your medical enrollment. Let's take a look. The first thing you will do is once you receive your welcome email from Benefit Bay, it will look similar to this. You will click the blue Set Password button in the email, and it will take you over to our platform. Here you will enter your email address, which should be a personal email address. It's the one that you receive the notification in, the welcome email, and you will set a password. You will have to enter the password twice for confirmation, and there are some restrictions, but it will walk you through and tell you whether or not that password is valid. Once you are logged in, you will see you are taken directly over to your enrollment. You can see at the top here your enrollment ending date and the effective date for your medical coverage. On the left side here is your navigation bar, and after you get through your completed enrollment selections, you will see some of this information will start to populate with data. So if you would like to waive your enrollment, you can do that right here. I would encourage you to go ahead and at least validate your personal information and your employment information just to make sure that is correct within our system. So we're going to go ahead and walk through enrollment. First, you're going to click Verify My Information, and you can see we're going to verify personal information. So I have my name, my date of birth, female, my social security number. Please go ahead and select the little I icon and double check and make sure that is your social security number that's been entered correctly. You will want to make sure there's a personal phone number here. If there is not one, you will need to put one in, otherwise the platform will prompt you to. Double check your email, and then if you are a tobacco user, please go ahead and select yes. This will change your rates that are shown to you in the shopping, so that's why it's very important to get that right to make sure that you have the correct pricing. And then your home address, you would have your address here. You could populate that. Once you have validated all the information, you're going to select continue. You can see you're going to your employment information. This is just an opportunity for you to confirm the information. You will see you won't have the ability to change anything that's in here, but if you do notice that something needs to be updated, please contact your human resources department, and then they can log in and make sure that everything gets updated in our platform. You will have some of this information maybe blank, and that's fine. Your work phone number and work email can be there. Your pay type is important as it can potentially impact your employer contribution. So if you are paid hourly, then you should have hours per week and hourly rate. If you're paid on a salary basis, then you would have the salary and the annual wages. So I would ensure that that stuff is correct, as well as your work schedule, full-time, part-time, and then your work site location may or may not be there, but it should match what you're familiar with. Once all that information is correct, go ahead and select confirm. Again, if it is not, then you would want to reach out to somebody at your company. So here is your address information, and I'm going to go ahead and get some added for me here because you can see they didn't have my street address in there. You can see how easy this is to just get that added. They did have my city and my state and my zip, and that's all correct, in the county. So I'm going to go ahead and hit continue. If you have a zip code that has multiple counties, you do want to double check and make sure that information is correct so that it gets to your carrier correctly. Go ahead and select continue. And you can see, good job. You do now have a little progress bar, so you can see you've completed one of the steps out of the 3. If at any point in time you get through a step and maybe you have to take a step away, just note that your progress is saved on the page you were in, and then when you log back in, you can restart here. So we're going to continue on to the next step though, and it is adding any other dependents or family members that I want to cover. So you can, yes, add family members, or no, it's only for myself, and then that will continue you to move forward. We are going to go ahead and add a family member. So I'm going to add a spouse. Please note that you will have to put in their Social Security number and their date of birth, as the carrier will require that information to get them enrolled in their plan. You can, again, if you want to double check and see what you input there, you can double check it. I do encourage you to do that, just making sure you got that correct, as well as their date of birth. It's very important to get that correct as well. Okay. Gender, and then the home address, if same as yours, you can enter that in. And again, if they're a tobacco user, that is important to put there, as it can impact their rates. We're going to select Save Changes, and now I've got my family member here. You can also see that my family member is completed. If your employer had some of your dependent information, maybe based off you had them covered on the previous plan, you may see them already entered in here, but this would say incomplete or pending, and it would be red. That would indicate that there is something missing from their profile to get them completely enrolled. So please make sure that you click in here, and then you can check all the information. A lot of times it could potentially be the Social Security number is blank, so make sure you get that information in there. You can also see that I can remove this family member. Maybe I covered some people last year, but I don't want to cover them this year, so you can remove the family member. And you can add more family members, or if you've added who you needed to add, you can go ahead and select Verify and Continue. So now you can see I have moved on. I have steps 2 through 3 completed. So now we're going to continue to the next step. So now it's asking if you have any preferred health providers. This is important for a couple reasons. Number one, if you add in health providers, you can search on plans and make sure they're in network and things like that through the shopping tool. We do encourage you to always contact your provider and make sure that they still carry the coverage that you are looking at potentially selecting, because they do have different contracts with the carriers, so that can change from time to time, and they may not have provided that information to us yet, to the system where you get that from. So you can add a provider. Also, there are some coverages that require a primary provider be selected. So I would encourage you to go ahead and add a provider, then search by zip code or search by name. You can also search by specialties, or if you go to a specific clinic, that type of thing. So you will see 2 different locations here, because this is 2 different clinics that this provider works out of. Be sure to select the right clinic. And would you like to add them as the primary care? Yes, I'm going to assign them as primary. You can assign them to both yourself or separate people within the policy or that you want to cover for family. That can be important. You might, have a pediatrician that you really prefer for your children, things like that. So you do have the opportunity and flexibility here to add what is necessary for your family. In this instance, I'm going to put that this doctor is the primary provider for both me and my spouse. Hit continue. If I want to add more providers or clinics, I can go ahead and do that. Or if I have gotten a primary provider for everybody and all my specialty doctors, I'm going to select done. Now you can see I'm going back to the enrollment. I've got all my verification steps completed. You have the ICHRA agreement is the first document that's required a signature. This is a lot of very good information. I do encourage you to go through and read it all. Essentially, it's talking about the advancement on future wages. If you are selecting a plan that's larger than your employer contribution, it talks about subsidy coverage through the government. If you are selecting a subsidized plan, there's a lot of legal information. There's only 2 pages, so I do encourage you to read it in full. And then once you've read it, you can digitally sign your name. to hit submit signature. Now that's going to automatically take you over to the HIPAA agreement. Again, I do encourage you, you can see it's only one page. Go ahead and read through everything. Essentially, this is stating that you're giving Benefit Bay the authority to act on your behalf to get your enrollment completed in addition with your carrier for this year. In addition, it will also allow us to work with your policy if anything comes up with your carrier. Once you have read through all of that information, it does tell you what we are allowed to share and what we won't be sharing, things like that. You will go ahead and sign your name. And now you can see I have the ability to shop for plans. You can also still go ahead and waive here. So go ahead, and I do encourage you again, go through at least the validation of your personal information and your employment information, and then you can see you still do have an opportunity to waive. Or if you just want to shop around and then at the end you determine a plan's not best for you, you can waive coverage here as well. Let's take a look at the plans available. I am going to actually shop up for a plan for both myself and my spouse. If for some reason maybe you only wanted to shop for a plan for yourself, you would just unselect your spouse, and then when you hit the save button, it's going to go out and look for plans that are available for just you. If you select both you and any dependents you have listed, when it goes out to get that information, it's going to be pulling in premium prices for a full family or spouse, things like that. So you can again see here, my available employer contribution is this amount, and that can change depending on who all you are going to be covering. So again, I have me and my spouse selected, and I'm going to hit save and continue. Now, if you have a child or a dependent that you need to cover that's in another state or lives at another address, this is why you have an address selection here. You can, after you've selected your own plan, come back in and select a plan for your dependents and change the address to their address. But for now, we're going to hit save and continue. This might take just a little bit of time. You can see it's pulling in plans. So a couple things I want to pause right here. You can see that I have 38 plans available to me in the zip code in which I live. Now, if you have a preferred plan selected for you, this could be potentially a plan that was very similar to the last plan that your company was on, or if you're renewing coverage this year and you had a coverage that was selected last year, you might see that one populate first. It could be green, a preferred plan might be blue, but there should be a little filter at the top where you select all, and then you can see all the plans available to you, or if you want to focus in on your renewal plan, you can filter those as well. Another thing I want to point out before you start navigating through all 38 plans, you can filter them by different things. So what's important to you, how much the premium amount would be, how much it's going to cost you per paycheck, or the deductible is how much the deductible for the plan is. So you can sort by that way. In addition, there are filters. So there are carrier filters, metal level, plan types, HSA eligibility, networks, and providers. So again, because I added a provider, I can see this information here. So you can select in here what is best for you. Maybe you like a specific carrier, you've had them in the past. Maybe you know what metal level you are most interested in looking at, or a plan type, that type of thing. Or you can leave all filters off and look at all plans that are available. Me personally, I do like to select the different carriers. That kind of narrows down my selection. So I'm going to apply that filter. And now you can see instead of 38 policies and plans I'll be looking at, for right now, I'm just going to look at 10. So then you can go through here. I'm just going to very quickly show you this one plan here. You can see, and then we're going to take a look at the comparison tool. So you can see this cost per paycheck is 0. So if I selected this plan, it's going to not cost me anything for my paycheck. It has the carrier information, the plan name, the plan ID, the individual deductible and out-of-pocket max, and the coinsurance. If you select show more details, as you scroll down, you can see doctor visit, copays, prescription drugs, the plan type, and just other information that it has, the family deductible. You can view the summary of benefits or the drug formulary. As you continue to scroll here, it will tell you how much it costs. You can see that my provider is actually not in network for this plan. So maybe this isn't a good plan for me, but it's just something that you can look at. I want to quickly show you the comparison tool. So you can select, you can see down here at the bottom now, this button has become available. I want to actually select 3 plans. And now you can see, you can look at those plans side by side. So these are all the same carrier because I have them filtered by carrier, the plan ID. So it has all the information laid out for me. You can see I can also print this out. So you could save a copy and send this to yourself in an email so you can kind of review it with any other decision makers at home, things like that. So you can look at this different information side by side. In addition, if you want to remove one of the plans because you know that is a definite no, you can remove. If you know you want one of these plans, you can select. But let's just say we want to go back to all plans. You can see that filter is now off and I'm viewing all plans again. Once you know which one you would like, you are going to select and then hit select this plan instead of compare. One last thing I do want to tell you is maybe you're looking at all these plans and you're like, I just don't know which one that I would like to do. So you can see right down here, if you need help selecting a plan, if you select this button, it will take you to a calendar invite, at which time you can schedule with an enrollment specialist. They will ask you some questions, get better understanding of your medical needs, and then they will help advise you on a plan that would fit you and your family's needs. So for right now, I'm going to go ahead and select this. I don't want to compare it. Let's see where the other plan is that I have compared. So I'm just going to select this plan. I know this is the plan that I've looked it over. This is the plan I want for my family and myself. So I've selected it. Now it's time to confirm that plan. So the plan details are on the right-hand side of the screen. You can see the participants as both me and my spouse. And once I do know I want this plan, I'm going to submit my application. And now you can see that it says that my plan is processing. So what that means is that information has been sent over to our enrollment team and they're going to be taking a look at it and getting it enrolled for you. If you want to come back and check the status, when you come back, instead of processing, it will say enrolled, it will be green, and you will know that our team has given your information over to the carrier and gotten your plan submitted. And then once the payment clears through, you will see that as well. That is all you need to do as far as your enrollment. You can see that both a plan was selected for both me and my family member. If you have additional family members that you didn't select a plan for, you could enter in the shopping and go shop for a plan for them. But at this time, that is all that you need to do. One last thing I want to quickly show you is if you go to your documents section and the plan that you selected, the stuff you signed is all showing up here. And you should have your benefits summary as well. But this individual coverage HRA, if you get a notice from the carrier asking for a coverage letter, a letter from your HR department, things like that, that's where this is at. This is just stating that you do qualify for an individual coverage through your employer and they have given the information. This is what the carrier is needing. So again, if you have any questions on your enrollment process, please reach out to us by using this chat icon at the bottom, or you can reach out to us at benefitbay.com. Thank you for taking the time to follow along on the enrollment journey. Remember, if you need any assistance, you can connect with us by sending an email to support@benefitbay.com. Thank you again for partnering with Benefit Bay.